So we now have Professor Oliviero Bruni from Sapienza University in Rome, and he is going to talk about the results of a paper that we recently published in the Journal of Clinical Sleep Medicine. His talk is entitled Using Autovideosomnography to Better Understand the Relationship Between Temperament and Sleep. Okay, thanks, Oliviero. Take it away.
Thank you. I'm very excited and grateful for participating in this very interesting meeting. So with the Nanit, we started to work together around 2 years ago, and we made a lot of project and study, and there are also other studies that are going on. What I will present now is the relationship between sleep and temperament and the connection with parental practices at bedtime, studied with autovideosomnography. So we know that temperament and sleep are really connected between each other and are influenced by different factors, parental culture and style of interaction, and they interact with genetic and neurobiological factors and influence the development of the temperamental traits that we know are genetically determined. But on the other hand, there is also the transactional model of infant sleep in which that report that sleep is ecologically based. So also parenting factor and the intrinsic infant factor may influence sleep. So we know that we have different kind of children with easy temperament that are positive, they smile, they are easily approachable, they are extroverted. But on the other hand, we have the children with the difficult temperament, with negative emotional state, with irritability, low frustration tolerance. They manifest fear, anger, and sadness and discomfort. And all the children with difficult temperament have sleep problems. And there are several studies, or even older studies, showing this connection between sleep and difficult temperament, because the low sensory threshold and poor adaptive skills probably they produce a sleep problem in children. And what we have done is a cross-sectional studies in which we asked about temperamental traits, if they correlated with sleep characteristics, and if the ecological environment and parental behavior at bedtime may influence this relationship between temperament and sleep. So we used the Nanit camera with video sonography, and we derived the different sleep metrics from the video sonography. And we also give the Edinburgh Postnatal Depression Scale, the infant behavior questionnaire for infant temperament, and the parental bedtime routine evaluated with the BISC-R, the Brief Infant Questionnaire revised. So we analyzed 623 infants, and we published this just a few times ago, this paper, and more than 4,000 nights, and the mean age was 10 months. And you see that around 30% of infants fall asleep with breastfeeding or bottle feeding, and 32% of infants held or rocked while falling asleep. So the parental practices may influence the sleep of the child. So, and we found that bedtime routines were the strongest predictor of sleep metrics, and active physical comfortings and maternal breastfeeding or breastfeeding were associated with difficult temperament and worse sleep pattern. We don't know really the direction of this correlation, but this is a very strong correlation. Difficult temperament and worse sleep pattern are related to the physical comforting of the parents. And this is in line with the transactional model of sleep and is confirmed previous studies. And the correlation with temperament is really interesting because the higher negative emotionality correlated with most of the sleep metrics: delay in bedtime, night sleep duration, lower sleep efficiency, night waking time, number of night wakings, and number of caregiver visit. So this is a very strong correlation, and we don't know exactly the direction of this, but for sure it is really important. So another study that is just accepted on Journal of Clinical Sleep Medicine, and I think this is a very important point, because if we try to characterize sleep in very early infants, we can identify the infants with sleep problems, and we can act and evaluate the more accurately the sleep of these infants. So we have 3 clusters. We analyze it with a statistical analysis, with a cluster analysis, and we found that there are 3 types of sleepers: long sleepers, interrupted sleepers, and short sleepers. And you see that interrupted sleepers, for example, have the lowest sleep quality, and they have the highest number of night awakenings, the pink color. And the short sleepers are obviously later bedtime, but no difference in wake time. Oh, sorry, no differences in wake time. And the best sleepers are the long sleepers that have long nighttime, efficient and stable sleep duration. So this is very interesting, because if we characterize this kind of children, probably we could find some genetic traits that are related to these 3 different kind of sleepers. And when we correlate this with the temperament, we found that interrupted sleepers and short sleepers show negative emotionality, greater sadness and fear, lower tolerance to limitation, and more difficulty recovering from distress. And while the long sleepers are the best, with probably those with this temperament are the long sleepers. And so in conclusion, we have different point of view. If we look at temperament, we see that difficult temperament is related to worse sleep problems and poorer sleep quality. But on the other hand, the lower sleep quality may increase irritability and decrease the self-regulation abilities. So the self-regulation is in some way impeded by the parental practice in some way. And sleep problem in children may require parental intervention and bedtime during the night. And as I said before, the active physical comfort at bedtime may predispose to sleep problem in children with a difficult temperament. So we don't know the direction, but if we try to find exactly the type of sleepers, then we can really correlate and analyze everything on this. So I finish, and thank you, Maristella, thank you, Natalie, and thank you, Maria. That is one of my fellow. Thank you.
Amazing. Thanks, Oliviero. That was really fantastic. If anyone has any questions for Oliviero, we have a couple of minutes for questions. If anyone wants to pop anything into the Q&A section. I wanted to ask you, how do you think sort of better understanding this relationship between sleep and temperament can inform sort of better identification of sleep problems, and then better help support families in whatever interventions they choose?
Yeah, for sure. If you look at the sleep of the child, you can try to analyze also the parent-infant relationship, and you can identify probably if if it is more the parent that influence sleep, or if the child temperament that influence parent behavior. So if you try to analyze temperament, you can have a better view of the infant-parent relationship. And on the other hand, when you ask parents how do they manage sleep, then you can clearly identify if there is a problem of the parents or the child. So, and this is extremely important in my opinion, because you should evaluate if this child and this parent-child diet is can have a behavioral intervention or not. So we can also evaluate if behavioral intervention in those cases may be helpful or not.
Yes. Yep. No, that's great. Okay. Well, thank you so much. We are incredibly grateful for your work, and we love working with you, and are excited to continue this work.
Thank you. Thank you.
Oh, sorry. Tom is asking a question. He's saying, can you comment how easy Nanit was to use? Great question, Tom.
How is it?
How easy was it to use Nanit data in your research?
No, it was very easy because the data are made by the Nanit lab, and we analyzed the data that we received from the Nanit lab. The sleep metrics are very useful, and then it's very easy to make statistical analysis and everything. So it's really easy, and it's really powerful method.
Oliviero, we really appreciate that. And Tom, to elaborate a little on your question, with this study in particular, we recruited participants for Oliviero's study from our current user base. So we have a very large user base that are very willing to participate in research. We emailed a sample of parents and asked them if they were willing to participate in research. So they already had the camera set up. These folks then consented to participate in this study, agreed to share their sleep metrics with Oliviero, as well as all of the survey results that they then completed as well. So it's a very easy way for us to compare these objective sleep metrics with these survey responses really at a scale and with ease. So it's a great way for us to be working together. So thank you so much, and great question, Tom.